Hello, all. Welcome to OET Answers. I'm here to clarify the concerns many of my students will have how to identify the known case and unknown case in OET speaking. So that is really simple. Uh, this often occurs among beginners and advanced stage students. So I'm here to clarify your concerns in this single approach. Shall we proceed? First, let's see about unknown case. What is unknown case? Unknown case in the OET speaking is nothing but it is a situation where nurse meeting the patient or the patient carer or the patient relative or speaking to a patient carer or patient relative for the first time. This is very important. First time, whatever conversation you are maintaining and how you are proceeding with the patient consent, so everything happens at the first time, that we will call it as unknown case. Got it? Then you don't have prior relationship, which means there will not be any prior conversation or consultation with a patient or patient carer or the relative, and they may little or nothing about their condition, treatment, or reason for being seen here. Okay, what is the purpose of the visit to the clinic? So you don't have any idea about when you before begin the consultation or conversation. Correct? So when you start a conversation, that time you are obliged to start getting answers by approaching with the questions. Okay, that is completely new patient. First time you are seeing. Are you clear with this? Now, an unknown case means, for your better understanding, the patient is new to you. So this is first time that you are meeting the patient. Second is, this is your first time meeting or speaking to them. So, starting a conversation at first. Then, you have no previous relationship with a patient or caregiver. So, you haven't seen the patient or the relative, or you haven't aware about them or their condition. So, these three are the 3 points they have given to better understand about the unknown case. Clear about it? So this is the guide, okay, how to identify. So think that you have a role play card in your hand. Your role play card says you are seeing a patient for the first time. So in this scenario, first three lines. Okay, first three lines will be there, right? Before the task, you can see a scenario or the background. There you can clearly see you are seeing the patient first time. So this is visibly they are telling. Then second one, patient is now to the clinic or newly referred. So newly referred or patient now visited the clinic. Patient has visited the clinic. Sometimes grammars. Okay, grammars will help you to find the unknown case. Patient has visited to the clinic today. Like if they given means, you can consider this is also unknown case. Then third one, no prior interaction is implied. So this indicates first time you are visiting the patient. Unknown case overview. So first introduction. How the introduction will be? First, how will you introduce usually? Good evening. My name is Miss Priya. I'm one of the registered nurses working here. I'll be taking care of you today. How may I address you? Or may I know your name for the documentation purpose? For the documentation purpose, could you please share your name here? Okay, so like we will start conversation. We will start introduce yourself first, and you may gather some details about the patient identification, like patient name and age you will be asking at that time. Okay, then what next? So what is bothering you? Right? What is bothering you? How may I help you today? You seem distressed. May I know the reason? This is about assessment. Okay, if you see patient seem angry, distressed, disappointed, or completely anxious, means based on the assessment you're gathering information. What is bothering you? Before we begin, could you please tell me a bit about the how have you been feeling lately? So these are all the words or the phrases will help you to get the answers from the patient about their condition or the problem that they are facing. Clear? So this is about introduction. This will comes under body of the conversation. Okay, so in the body of the conversation, you might know that find out the reason behind it, or find out the reason for the patient visit, find out the patient for the appointment, find out the reason for the patient's referral. Okay, so these all the sentences will help you better to know about the this is a unknown case. Okay. Then, for the documentation purpose, so this is about asking the patient's identification details. That's all. So these are the common phrases that we are using to identify the unknown case and approaching with the unknown new patient. Okay. So there are lots of terms and phrases there to approach known and unknown cases. Let's see. Okay. Let's see in the further videos. Now, we are learning about noun case. Noun case means you know the patient very well, or you must have idea about the patient previously. What is noun case? In OET speaking, noun case refers to a patient or caregiver that the healthcare professional you already knows or has seen before. Okay, underline this, already known or has seen before. In other words, this is not a new patient. Okay, so completely opposite to the unknown case. So, how can you understand better about known case? You have a relationship with a patient. Example, when you're taking regular follow ups or when you're meeting the patient often or regularly. So, that time you might know about the patient and patient situation, right? Then patient may already know about their condition diagnosis or treatment, so regularly attending the clinic or the routine checkup, or after getting the diagnosis, patient frequently coming to the clinic for getting prescriptions. So these are the some scenarios, and the patient may know about their condition diagnosis or treatment. So when patient admitted to hospital early morning admitted, or yesterday night admitted, or for the past 5 days or 6 days patient is being here, so you might have some idea about the patient when you're taking care of the patient, right? So about the diagnosis, treatment, from the first day onwards up to today, what are the care nurses, doctors are providing, everything. You're likely reviewing, checking progress, follow up. Okay, so especially discharge. So discharge information, that is easy to find out. Whenever you see the discharge word on the cue card, you can understand that the patient is a known patient. Okay. Admission also will indicate that still when you're assessing admission, you should be careful. Means admission means on the time admission will be there, prior admission also will be there. So based on the scenario, it will differ. Okay. Now the guide. How to identify a known case in OET speaking. How to identify? So first check the top of the roll call scenario. So look at the first sentence under setting. So under the setting, what is the first sentence? Some two, one or two lines or three lines, four lines will be there, right? That is about scenario. So it will say something like, you are speaking to a patient you have seen before. These are the visible clues. You are talking to a regular patient. You are following up with a patient. So these are the visible clues only. Patient came in last week. So indirectly, little bit showing indirect term. The patient came in last week. So you are reviewing the progress with a patient. So review the progress with a patient. These all the terms will be there in the scenario to understand it's a noun case. Then here second one is look for clues in the task and bullet points. Okay, so here below the scenario you can see some bulletin points, right? So with the bulletin points you can see the clues. So first one, the clues that it is a known case include discuss the progress since last visit. Since last visit indicating known case. Discuss the progress. Okay, that will give you better idea. Remind the patient about. Word remind. Remind will help you to identify it as a known case. Review the treatment plan. Review word. Check how the patient is managing. Check how patient is managing. So after surgery or after treatment, how the patient managing at home. Okay, how is the progress level of the patient? So everything is about known case only. Follow up on the follow up word on the medication that you prescribed earlier. Okay, indicating known case. These show you have already had contact before. Clear? Okay. Then third scenario is setting a tone clues. Setting and tone clues. So if the setting means like a place where actually the conversation is going. So for general practice with follow up means that is known case. General practice is a location with a follow up appointments or follow up referral means that we can consider as known case. And hospital, in the hospital two types of conversation, known and unknown conversation will be there, but in the hospital review appointment, discharge discussion, preparing the patient for surgery, these are the words indicating known case only. Then home visit, often home visit will be the known cases. Regular, based on the scenario it will differ. Home visit, regular patient, okay, regularly attending, so these are often known cases. Got it? So I'll just scroll with a quick tip. Ask yourself, is this my first time seeing the patient? If no, then it's a known case. Okay, you know very well that is different from unknown and known. So we can say about the known case overview. So if you have full idea about unknown case overview, you can tackle this very clearly. Okay, so first introduction, how the introduction will be there. Okay, so prior to the speaking, 3 minutes duration will be provided for preparing cue card. Correct. In the meantime, you need to ask to the interlocutor, how may I address you? Or how may I address the child? How may I address the patient if two persons involved? Okay. How may I address the mother or how may I address the daughter? Like you need to ask during the 3 minutes. If you fail to ask means that will be considered as you did not find out about the case. Okay, then how the introduction will be there? Let me remind you. Good evening. Let me remind you. My name is Miss Priya. I'm the registered nurse working here. I will be taking care of you today. Clear? So, body of conversation. We can see body of conversation, everything detailed in the upcoming pages, but here I would like to give you some hints. Body of conversation, how the body of conversation will be there. So, the purpose of visit will be mentioned. Okay, purpose of visit will be mentioned like a home visit cases. I'm here for discussing about the discharge process. I'm here to look out about your progress after the surgery. Like you may get the conversation. Then, final part. See here some phrases. Good morning, Mr. X. Let me remind you, my name is Miss Priya. I'm the registered nurse here. How may I address you during our conversation? For the confirmation purpose, may I know your name? So, appointment cases, review cases, discharge cases, admitting based on scenario. So, lots of cases are there to know as known cases. Some common phrases I have listed out. You have come in today to discuss your recent blood test results. When patient are coming, already patient gave blood test here. So today he has come to discuss about the blood test results. So now you're illustrating about that. Okay, this is about known case. I see you here today for your dressing change after the surgery. So already you know the patient. I'm here to discuss your discharge today. So discharge word comes. So you can understand clearly. I understand you were recently diagnosed with the type 2 diabetes. So recently diagnosed with type 2 diabetes. They did not talk about other hospitals or in between two hospitals. So just they said you were recently diagnosed with the type 2 diabetes. So you can understand this is a known case. I see you have been referred for consultation. Referred. You have been referred for consultation purpose. So this is a purpose. So if I'm right, are you here to discuss your pre-operative assessment? So surgery will be there on weekdays. So now here, are you here for preoperative assessment? So this is about known case. Before we begin, there are any concerns that I can help you with? Okay, this also when you start conversation, you can start like that. Is there anything that I can help you with? All right, so that's all about the known case and unknown case. So when I'm explaining, really it is easy for you, but when you have the hectic time, that time you have to analyze very well what is known case, what are the indications of known case, what is unknown case, what are the indications of unknown case, how to approach the known and unknown case, everything you have to get better idea. Clear? All right, so that's all about that. Thank you. For more queries, put everything on your comments. Thank you.